As the baby boomers begin to reach retirement age, many are dealing with aging, frail parents who require ongoing medical care. Unfortunately for many families, it's financially unaffordable to have 24-hour home health care, and they have to place a parent in a nursing home. No one wants to be in that situation, and today organizations like the A&D Charitable Foundation have proposed a solution to this crisis. Upon finalization of the regulatory process, the A&D Charitable Foundation has broken ground for the proposed Great Lakes PACE Center. This building will impact the elderly throughout Saginaw Bay and Midland counties. It's located in Saginaw Township on Fashion Square Boulevard, just north of Shattuck. It will be a 20,000 square foot building that will house a primary care medical practice. It will have a pharmacy, a rehab program, physical therapists, occupational therapists, speech therapy, and recreational therapy. It will provide meals while open in the daytime from 8 until 5, Monday through Friday. The interdisciplinary care management team, comprised of registered nurses and social workers, will assess each participant, develop their care plan, and determine the frequency they'll need to visit the PACE facility. Here's State Senator John Moolenaar.
It's something that for our seniors who are aging and gives them options and choices, and it's a great thing for the state of Michigan because it allows us to care for our seniors in the most efficient way, but also giving them the best possible care.
Thanks to the vision of Rosalind Argyle and her executive team, they're not trying to figure out the healthcare system. They're actually getting it done. This building will provide a complete, comprehensive, high-quality array of medical services for so many people in need. Currently, there are approximately 120 PACE programs throughout the United States, with 6 PACE organizations in Michigan. Henry Ford Hospital downstate opened the first and then a second. Grand Rapids, Kalamazoo, one near Battle Creek, and one in the Ypsilanti Ann Arbor area. This will be the 7th. Our neighbors to the south in Genesee County have embarked on a PACE program conducted by Genesis Hospital. They will become the 8th. And at the groundbreaking ceremonies last May, Bob Vandeventer, the president of the Chamber of Commerce, told me this.
I went out to the PACE website to learn a little bit more about it, and it's a national program. We just haven't heard much about it here in Michigan, and I think this might be an eye-opener for some folks.
Ken Horn met with me and had this to say about it.
You know, in Saginaw County, back when I was a county commissioner, they were really a focus with our senior centers and how do we get transportation, whether it's through the Commission on Aging, whether it was through STARS, how do we get people from their home to the doctor in facilities like this one coming up, and the opportunity for them to spend an entire day here kind of with a wraparound care system is something that we've always had a focus on.
The PACE program is an innovative, fully integrated provider of care for the frailest of our frail elderly, who are actually the most costly. This is a collaboration between the federal and the state government to meet those individuals' needs on a cost-efficient basis, and this has bipartisan support.
Growth for our community and for the Great Lakes Bay region, tremendous input of new jobs in here is vitally important as we keep trying to move the region forward in a positive direction.
The individuals that come to a PACE program are at least 55 years old and must live in a PACE service area. The federal government has very stringent guidelines as to the specific zip codes that Great Lakes PACE may service due to the transportation time from point A to point B. The people that will be serviced are people who meet nursing home eligibility requirements, but they will not have to reside in a nursing home if they can be brought into the PACE program. State Representative Stacey Irwin Oaks and I chatted about the project.
The services that are being provided by PACE are very comprehensive and allows for everyone to improve and keep their quality of life.
One of the exciting benefits of having the Great Lakes PACE project in Saginaw Township was expressed by Don Travers, the Dean of Health Sciences at Delta College.
What we like to do is collaborate with institutions where we bring students out to get a clinical sense of what's going on. So not only do we do the didactic at the college, but we can also come out and do our clinical work in facilities such as this. So it makes a great working relationship and partnership with the two entities.
It's a great investment for Saginaw. I think Roz Argyle and her team deserve a lot of thanks for moving forward on this. It provides options for seniors, and sometimes the most vulnerable, those who are most frail, that maybe don't want to be in a nursing home but need those wraparound services, whether it's care throughout the day or relieving the burden on a loved one who's caring for their spouse. Those are all important things for our region.
The inescapable challenges and tough decisions that lie ahead for so many people are no longer as gloomy as they once were, thanks to the A&D Charitable Foundation bringing the Great Lakes PACE program to our area. Your loved ones can remain at home, receive high-quality medical care, and spend their golden years with the people who have loved them throughout their lives. Our thanks to the vision of Rosalind Argyle. Your initiative and long-term benefits will greatly impact the senior population of Saginaw, Midland, and Bay counties in the coming years.